Hello everyone, this is Dr. Simran and welcome to my YouTube channel. Hope you are doing great. In the previous video, we discussed about the registration process. That was the first part of the AMC journey. Today, I'll be discussing about where to start your studies from. I know for a beginner, it is very hard to find all the resources in one place, and I know that struggle. And since everyone has a different way of studying, so I'll be sharing what resources helped me, what was my experience, and how it worked for me. Okay, so let's start with the resources that are required for the AMC MCQ exam. So the first is AMC Handbook of Multiple Choice Questions. We call it Blue Book also. This book basically contains around 650 to 750 MCQs, each with a detailed explanation. The questions are structured according to the real AMC MCQ exam. So when you will get through this book, you will get an idea how the real exam looks like. And the explanations are very important. The reason I'm emphasizing on this book and the explanations is that questions do come from the explanation part also. So please do not cram the answers, do not remember the answers, just make your concepts clear. Read the explanations thoroughly because you should know the topic. You should have knowledge of the whole topic, not just the particular MCQ. Correlate the topics with the guidelines as well. One problem with this book is that since it is in its old edition, it's an outdated book. So what you have to do is you have to correlate the topics with the guidelines so that you will get the authentic information. Read this book for at least 2 to 3 times, and please, if you are new in this journey, you must start with this book so that you will have an idea how to prepare further, how to start your preparation, what to study and what not to study, so that you do not waste your time on irrelevant topics or irrelevant things. Okay. Next is John Murtagh. John Murtagh is the main reference book. It has 2 volumes. It is a very somewhat lengthy book. So I will suggest you do not read the book from cover to cover. Just get an idea from the handbook, from the question banks, from the recalls, that what topics are important, what topics are frequently asked in the exam. So just focus on those topics from the JM and read those topics from the guidelines as well. Because it's very hard obviously to retain all such information. So yes, read the important topics, correlate the topics with the guidelines. Let me know if you want me to make the separate video on the high yield topics or how to study John Murtagh. Okay. Next is psychiatry. Psychiatry is a very important subject for AMC MCQ exam. For psychiatry, JM has topics related to the psychiatry in a separate portion with the name of mental health, and some topics are scattered in this book as well. So what I did for myself is I studied John Murtagh. Along with that, I studied Kaplan Step 2 CK for psychiatry as well. I will suggest you guys to read Kaplan Step 2 CK as well, because it is a very concise book and it was very helpful for me. It has very good information related to psychiatry and it is very concise, so it's easy to remember psychiatry from that book. And since it is an important subject, so you cannot ignore psychiatry at all. Okay. Next is for obs and gynae. I studied John Murtagh. John Murtagh has a separate section with the name of women health. Okay. It contains many topics related to gynae and obs, but I found that obs is not better explained in John Murtagh. Since it has a lot of topics related to gynae but not related to obs. So I studied Kaplan USMLE Step 2 CK. For OBS as well, I will let you know the topics which should be studied from the Kaplan step to CK for OBS and gynae. So for that purpose, it was very helpful for me. Next will be ethics. Ethics, usually in some countries, ethics is not like considered as important as in Australia. So yeah, you should study ethics and you cannot ignore the ethics. So I studied ethics from the 100 cases, that is also the USMLE book, and along with that I studied the Qbanks, that is the Amedex. So for ethics, I think the USMLE 100 cases book and the Qbank, that will be quite like enough for the ethics for you guys to study. For pediatrics, JM contains a separate section of child health, and all the topics related to pediatrics are in that particular section. But I used step 2 CK, Kaplan step 2 CK along with the JM, because I feel that some topics are very well explained in the Kaplan step 2 CK rather than JM. Like, they are very concise and they are very good. So I'll let you know what topics should be studied from the Kaplan step 2 CK. Then comes the surgery. Surgery is basically not that important as compared to other subjects, but some topics are important from the surgery, and I used Kaplan step 2 CK again for surgery as well. We'll let you know the topics. Next comes the guidelines. So guidelines are 110% important for this exam, for you to pass this exam. Since Australia is very strict about guidelines, so you have to correlate your topics with the guidelines so that you get authentic information, because some books are outdated, some have old concepts. It's better for you to go through the guidelines for important topics, especially. Like, for example, for medicine and surgery, we use the RSCGP guidelines. For OBS and gynae, we use the SA Health guidelines. For pediatrics, we use the RCH guidelines. I'll try to make a separate video on how to search and how to read important guidelines so that there is no confusion left in your minds. Then the question arises, what Qbanks should be studied for AMC MCQ exam? So the Qbanks that are normally used for this exam is, one is the Amedex and the other is M+X. So it's up to you, it's up to people what they prefer to study for this exam. But I personally used Amedex for this purpose. Some topics that seemed important to me, I studied from M+X as well. But usually I followed Amedex for this purpose. And since Amedex has a lot of information related to the important topics and the explanations are good as well, so it's better for you to read the explanations thoroughly and to like keep in mind why are you ruling out this option, why this option is incorrect, why this option is correct. You should know each and everything related to that particular topic. Then it will be easy for you to to retain such information and to pass the exam easily. Then last but not the least is the recalls. Recalls are again very important part of this AMC MCQ preparation. Since sometimes recalls do get repeated in exams, and I also got many recalls from the previous exams as well, so I will suggest you to focus on recalls as well. Do not neglect the recalls. It's better if you do a minimum of at least 6 months recalls, or maximum of 3-year recalls are required to pass this exam. So but the main problem with the recalls is that they are incomplete. Okay, we do not usually get the complete stem, and it's very difficult obviously to remember all the stems that come in our exams, since the stems are very long and it's very difficult to memorize each and everything. So it's better to not remember the answers, do not cram the answers, just get an idea of the topic, read the topic from the books, from the guidelines, and it's better you should know about the whole topic rather than just remembering the answer, because the recalls do get repeated, but AMC twists the recalls. So yeah, it's better you should have an idea of the whole topic. I think that is it for the resources. Let me know if you have any queries related to the AMC MCQ exam, any queries related to the resources. I'll try to clear your confusions in the best possible way. Thanks for watching. Bye bye. Take care.